All righty, good morning everybody, and thank you for being on with us today for the March 2018 Tennessee SHIPSMP Volunteer Webinar Series. This month we are going to talk about the new 2018 LIS and MSP Income and Resource Guidelines. Those are just released. And we're also going to chat a little bit about dual eligibles, meaning the people who have Medicare and Medicaid, and some details about those individuals. Some of them pay nothing, some of them pay their Part B premium, and some of them pay their co-pays and co-insurance. So we will touch on that as well. So let's get started with low-income subsidy, or it's oftentimes, and I know I refer to it more as extra help. So this is through the Social Security Administration, and it's to help people who have low income and low resources get assistance for their Part D prescription drug plans, meaning that their premiums are reduced, they have no deductibles, and they have small co-pays for their generic and brand name medications. Some people have slightly higher incomes throughout the guidelines, and that could be reduced deductibles and a little bit more out-of-pocket expense besides the co-pays, and we're going to talk about those beneficiaries as well. The best benefit of extra help, in my opinion, and I mean we can debate this, but I think one of the best benefits of extra help is the person will never ever fall into the coverage gap or the donut hole. Oops, we got somebody's cell phones are ringing. So some people automatically qualify for extra help, meaning they don't have to do the Social Security application, and those people are people who have full Medicaid coverage, which means they have done applications through our Bureau of TennCare or through the healthcare.gov website. They are recipients of SSI, or Supplemental Security Income, or they have a Medicare Savings Program, QMB, SLMB, or QI1, which we're also going to talk about today. Anybody else who doesn't fall into those three categories have to apply themselves. Most people will use the online application through socialsecurity.gov. I know we have some volunteers in the South Central region that use Benefits Checkup. That's another way that you can apply for extra help. You can call Social Security. I don't personally recommend that one. We do get a grant, SHIP gets a grant to specifically help people with low-income subsidy applications or extra help applications, so we do want them to call SHIP. Or, of course, hopefully people in your community are coming to all of us, whether you be a SHIP staff person or a SHIP volunteer, in order to qualify and apply for these extra help programs. So our new income and resource guidelines for 2018. Before we talk about numbers, please everybody do me a favor. Do not, I know this is crazy, do not memorize these numbers. I'm going to show you, once we're done talking about all the numbers, some helpful tools and sheets and handouts that you can use, so that way you don't have to memorize any of this stuff. I have dyslexia. If I try to remember it, I'm probably going to mess it up. So I always have my tip sheets scattered all around my desk, as well as in all of my notebooks that I take out when I counsel. So someone to qualify for low-income subsidy or extra help has to have an income below 150% of the federal poverty level. So the maximum benefit that they can get, monetary benefit, is $1,518 for a single individual or $2,058 for a married couple. And it is based on family size. So incomes do increase if you have a family size more than two. Maybe you're a disabled beneficiary and you have 3 dependent children. Your household size could increase. So it is based off of that. Your resources can be up to $14,100 for an individual and $28,150 for a married couple. Those two numbers include $1,500 per person for burial expenses. Now, the one caveat I want to tell you about the funeral and burial expenses is that $1,500 per person has to be in a separate account. So if you have a checking account and a savings account, and you want $1,500 for funeral or burial expenses, you need an additional account specifically for that. It can't be included in one of your accounts already established. It does count any kind of savings or investments. So it counts your checking account, savings account, stocks, bonds, mutual funds, IRAs, stuff like that. So those will count toward resources, but resources do not count the home that you currently live in or the car that you currently own. So for a single individual, I have one car, that does not count as a resource. If I'm a single individual and have 3 cars, 2 of those cars are going to count toward my resources, toward that $14,100 for a single individual. Okay, questions on resources before we move on, or income for that matter? If you don't want to say your question out loud, you can type in your question in the chat box, and then Lonnie can read those to us, and we can answer those as a group. So however you're comfortable. So the benefits of extra help, your premium is reduced by $30.62 if you're enrolled into a plan that participates in extra help. Not all drug plans are required to participate in the extra help program. So you may not, I can't think of the one example, but a couple years ago, the lowest premium plan in Tennessee did not participate in the extra help program. So if you qualified for extra help, you were still paying the full premium. So only, I really want to stress, the premium is reduced only in plans that participate. Also, your copays for your brand name and generic medications are reduced to no more than $8.35 and no more than $3.35. You should have no drug deductible if you are in a plan that participates with extra help and you receive full extra help. So this year in 2018, the drug plan deductible is $405. If you qualified for extra help and that plan initially had a deductible, you would pay no deductible if you qualified for extra help. And again, my favorite benefit of all is you are exempt from the coverage gap or the donut hole. You will not fall into it. Some partial help may, oops, what's that?
Sorry, Sydney, we've got a couple of questions.
Sure, go ahead.
Did you say apply for QMB at Social Security?
No, we're only talking about extra help low-income subsidy. We haven't talked about QMB yet. I will get there, I promise. But right now it's strictly only extra help or low-income subsidy LIS that we're talking about.
Okay, there's another one. How do we know if a plan is not participating in LIS?
We don't know for sure. The best way to know is looking at the Medicare.gov plan finder. And when you look up a beneficiary and they have extra help, it's going to show you plans that have no deductible, or excuse me, no premium or reduced premiums. If by chance you have the 2018 Medicare and You handbook within reach, some of you may not, if you look at the very back of your Tennessee specific, now I really want to stress that out as well, if you have the Tennessee specific Medicare and You handbook for 2018, in the back it's going to list the drug plans and Medicare Advantage plans in Tennessee. If you see the premium is highlighted in blue, that means that is a plan that if you qualify for extra help, you will have a $0 premium. I hope that answered the question. Any other questions come in, Lonnie?
No.
Okay, perfect. Thank you very much. We also talked a little while ago that there are some people who are within the LIS extra help income guidelines, but they're only going to receive partial assistance. And this is how those folks look. So if you are below 135% of the federal poverty level, you get that full extra help. You get 100%, all the benefits that we just talked about. If you make between 135 to 140% of federal poverty level, again, we're still below that 150% limit, you're only going to receive 75% assistance. If you make between 140 and 145% of federal poverty level, you're going to get 50% assistance, and then 145 to 150%, you're getting 25% assistance. Now, notice I don't have the actual numbers, the monthly figures of what that income is, because I'm not sure. And to be honest, and this is how everyone's mentality should be, we do not make the determination if someone qualifies for extra help at all. Even if the beneficiary tells us, I make $900 a month and I have no resources, we as SHIP staff and volunteer counselors should not say, yes, you're going to qualify for low-income subsidy, because we don't know that for sure. Some beneficiaries, and we had quite a few cases here this last month, oh, I forgot to tell you that I have a pension, or I forgot to tell you about this investment or this property or something along those lines. So if we tell them, yes, you're going to qualify, and then Social Security, who makes the determination, says, no, you don't, that beneficiary is going to be really mad at you. So anytime we do an application, just say, this is what I say. Based on the income and resources you provided me, you're within the guidelines of these programs or this program, but Social Security makes the final determination, and you'll just have to wait for them to notify you in the mail if you qualify. Nowhere in there that I tell them, yes, you qualify or anything like that. We're just letting them know it's not our choice. We want them all to qualify, don't get me wrong, but we don't make that determination. So what are some of the benefits for partial assistance? Your premium is still reduced, so you get that full reduction of the $30.62 if you're at 100% of, or get 100% extra help, $22.96 if you're at 75% assistance, $15.31 for 50% assistance, $7.65 for, that should be 25, not 24%, I apologize. 24 is my favorite number, so apparently that's why I wrote that. But that should read in that slide, it should have 25%. I apologize, I will edit that before I send it back out to everybody. Additionally, for the partial assistance, partial extra help benefit, the maximum you will pay for your medications is 15%. So we haven't talked about the donut hole, but many of us know about the donut hole. We've talked about it many times in past presentations and at trainings. But let's say this beneficiary is on 2 kinds of insulin, and they're going to fall into the donut hole if they didn't have extra help. The maximum they will pay is 15%. That's the max. They'll never pay the full donut hole cost, but their cost may increase to the maximum of 15% for their medication cost. Also, the maximum deductible that they would have is $83. Again, the highest deductible you can have for Part D in 2018 is $405. So that will get reduced to that $83. That was a lot of information. So, Lonnie, did we have any questions come in the chat box? Okay, doesn't sound like it. All right, I am kind of going through this a little
Sorry, I have myself muted.
Oh.
Yes, there is a couple questions. If the person is over the listed amount, but only a few dollars, should we send the application in hopes they will get some assistance, even if it's reduced?
Yes, absolutely. When in doubt, always do the application. It's not going to hurt the beneficiary to do this application. It also shows that we don't make the determination. So anyone who says, I want to qualify or I want to apply for extra help, even if they are way over the limit, I will still do that application because they asked me to, and you never know. Social Security could have something on record that they haven't told us. We may think they're a single individual, but they're the legal guardian of 2 of their grandchildren. So it's actually a household of 3 instead of a household of 1. So always, when someone asks, even if you give them the income guidelines and they say, you know, I'm over, but I'd still like to apply, yes, please do that application for the beneficiary. Because you never know.
Okay, one more question.
Sure.
So people who have partial LIS still fall into the donut hole?
They fall into the donut hole maximum at 15%. So what could happen is they could have a copay of $5 for one of their, well, that's a bad example. Maybe they have a copay of $30 for their insulin, but their insulin is $700 a month. If they fell into the donut hole and they reached that full cost of their med number, off the top of my head, $3,750 for the total cost of their meds, if they reach that, their $30 copay could increase to 15% of $700. So they don't fully fall into it, but they could, their cost could increase to a full 15% of the cost.
Okay, there's another question.
Yeah.
If someone qualified for a lower level of LIS, such as at 25%, and their circumstances change, should we redo an online application or do a paper version?
Redo the online application. LIS applications are open year-round, so if anything changes, if there was a divorce, a death in the family, anything like that, or if anything happens in like my scenario with the grandparent being the legal guardian of 2 grandchildren, if they leave or if more family members come in, absolutely any kind of circumstances that have changed, redo the application through Social Security's website. 100%, absolutely.
Okay, that's all the questions that's come in for now.
Awesome. Thank you very much. Cool. All righty. So I'm going to open it up. Anybody have any questions they want to vocalize before we talk about Medicare savings programs? It does go a little bit quicker and kind of a little bit more organized when you chat them in, but I understand some people are like, I don't know how to type this question. I just need to talk it out. So anybody have any questions? You might be muted. So if you're trying to talk and we're not responding, that's probably why.
Mute everybody. Okay, I've unmuted everybody.
Anybody questions? All righty. Well, Lonnie, you can mute everybody again. All righty. Now we're going to talk about the Medicare savings program. When I talk about Medicare savings programs, that is the large umbrella that QMB, SLMB, QI1, and QDWI fall under. So whenever we say QMB, or Qualified Medicare Beneficiary, we are talking about a Medicare savings program. We are going to talk about all 4 of these that our beneficiaries could potentially qualify for. So, sorry, before I get into the income and resource guidelines, we had a question earlier about applying for QMB. The only way in the state of Tennessee right now to specifically only apply for QMB, SLMB, QI1, or QDWI is through the Bureau of TennCare's paper TennCare application. It's about 9 pages long. And if we need it, I can send it to everyone in our follow-up email. Actually, I'm going to write myself a note to send MSP application to everyone. Right now, that is the way if you specifically want to apply for one of these 4 programs, you do that paper application and you fax it in to the Tennessee Health Connection. Now, there are other scenarios, and I don't want to confuse people, and we can talk about this more specifically in a little bit, but there is a way that if a beneficiary has no assistance at all, say they're new to Medicare, they have no assistance, if you do the LIS application on Social Security's website, you can have that application sent to the Bureau of TennCare to screen for these programs. So in some cases, again, the person has no assistance, we can do the LIS application and it gets sent to TennCare to screen for these programs. If the person already has full extra help or partial extra help, anything that we just talked about, they already have some kind of assistance benefit, they have to apply using the paper application through the Bureau of TennCare. That probably confused some people. So did any questions come in, Lonnie?
No.
Okay. So I'm going to keep going. We're going to talk about QMB, SLMB, and QI1, and then I'll come back for questions in a little bit. So that could come up. If you still have a question about it, please feel free to type that in, and we can talk about it here in a little bit. So QMB's income is below 100% of the federal poverty level. And the full benefit, full income you can get, and all these incomes are on a monthly basis, by the way. It says per month. I don't want you to think that this is just for a year. This is the income you can have per month, is $1,032 for a single individual and $1,392 for a married couple. Something very important to point out here is the Bureau of TennCare allows what's called a $20 disregard toward these incomes, meaning the beneficiary can make $20 more than the listed federal poverty level. So really, for a single individual, the federal poverty level at 100% is $1,012, but with the $20 disregard, we're able to increase that to $1,032. The $20 disregard is added to all of the QMB, SLMB, QI1, and no, those are the only three. QMB, SLMB, and QI1 incomes for this presentation. So this is the maximum the beneficiary can make. Again, it's also based on family size, so we can adjust for more people than just two. Don't think that it's 2 people is the maximum. We can increase that. Our resources go down to $9,060 for an individual and $14,340 for a married couple. Again, includes the $1,500 per person for burial or funeral expenses, counts your savings and investments, doesn't count the home that you currently live in or the car that you currently own. I know it's going to sound like a broken record, so I'm not going to repeat that every single time, but the same rules that we talked about for LIS resources are going to apply for all of these resources as well, minus the resource limit being lower for our Medicare savings programs than they are for the low-income subsidy extra help program. So what are our benefits of QMB? It's like a free supplement through the state of Tennessee. They pay the 20%, Medicare doesn't pay for A and B. It pays your Part A and B deductible, which, yes, there is a deductible for Medicare Part A and Part B. Many of you have taken the SHIP certification exam, and we had a lot of people say that there was no deductible for Part A and no deductible for Part B. Yes, there are. I want everyone to know that there is a deductible for Part A and Part B. QMB also pays the Medicare Part B premium. So the $134 that most beneficiaries are paying, not necessarily all beneficiaries are paying that. In 2018, the Part B premium is $134. That should be paid for if the beneficiary qualifies for QMB. Also, the same benefits for full extra help that we just talked about, the copay is being reduced, no deductible, no donut hole, all those benefits are included with the QMB. Questions on QMB? I know this is like broken record.
There's a couple questions.
Sure, go ahead, Lane.
That's popped in. What other assistance would the person have to have that would require the paper application?
The assistance that the person would have to do the paper application is full extra help. So anytime, this is the best rule of thumb that I can give you, I hope all staff and volunteers do this, if you have access to a computer at the time the person asks you the question. So if someone comes up to me and says, I want to apply for QMB, the absolute first thing that I'm going to do is go to Medicare.gov's website, look them up on the plan finder, and see if they have any kind of extra help already. Full, what do they call it on plan finder? Full subsidy, partial subsidy, full dual, anything that says assistance on Medicare.gov plan finder. If you see, yes, they have assistance, you have to do the paper application. If you do an application on Social Security's website and they already have the assistance, Social Security is going to cancel the application and they're not going to send it to TennCare because they already have the benefit. So TennCare or Social Security is not going to process it. You have to do the paper application.
Okay, I'm going to unmute everybody in case someone else has another question.
Yes, Lonnie, I have a question, please.
Hold on. When you have a question, please say your name first. That way, two people are asking a question.
This is Justin Martin with Southeast.
Go ahead, Justin.
On the handout we got of the different MSP and LIS income guidelines, on the paper that we received, the resource limit for like QMB, SLMB, etc., was listed as $7,560. Is the $9,060 limit the actual resource limit, or?
Are you talking about the LIS brochure?
Yes.
Okay. So I want to point out, and you're jumping ahead of me, Justin, but that's okay.
Oh, my bad.
No, you're fine. So I really want to stress that these resources that we've talked about includes $1,500 per person for burial expenses. On that brochure, it does not include the $1,500. So that is the true resource amount, and I believe in the on the left side below the extra help applications, in red it should say an additional $1,500 can be added
I see that now.
for that in a separate account.
Okay.
Good question. For those of you who don't know what Justin's referring to, we are going to talk about that, and I'll show you the brochure he's referring to, so we can clear that up as well. So good question.
I have a question. Evelyn Kornreich.
Go ahead, Evelyn.
If a person has an income of $700 and as an individual, and she wants to apply for any of the programs you've mentioned, and she has very expensive medication, but her spouse has an income of, let's say, $1,000, which would kick them out, can she apply as an individual?
Only if they are not living in the same household. If they're living in the same household, then they have to count that together. The income and resources have to be combined. If you're married and not... Oh, sorry, go ahead.
I'm sorry. Even though there's, the difference between, 1,032 and 1,392, considering you're going from one person to two people is, doesn't make sense to me.
Right. It's very low income, and that when you look at the federal poverty guidelines, and I actually will be able to show you those, what the federal government shows as a household of 2, 3, 4, 5, and so on. So we have to go off of what the federal poverty guidelines list each year, and that's where we get those numbers from.
All right. Thank you.
No problem. Good question. Anybody else? Excellent. This is a really good discussion, everybody.
Okay. I'm going to mute everybody.
Thank you, Lonnie. All right. If we talk about QMB, SLMB, or specified low-income Medicare beneficiaries, between 101 and 120% of the federal poverty guideline, which this year, I will not forget this guideline, 1234, $1,234 for an individual. That one you actually could possibly remember. And for a married couple, $1,666. So you might remember that one just because 666, that's not the best number in the world. But that one you actually might, those two you might memorize, even though you shouldn't. Again, don't memorize the numbers. But $1,234 for an individual and $1,666 for a married couple. Again, resources are the same. Counts your checking account, savings account, stocks, bonds, mutual funds, all that good stuff. Does not count the home that you currently live in or the car that you currently own. And these numbers include that $1,500 per person for burial expenses. I'm going to jump right into the QI1, or qualifying individual benefit, and that's 121 to 135% of the federal poverty guideline, and that's $1,386 for an individual and $1,872 for a married couple. Again, resources stay the same. So why did I put both of those back to back? Because they have the exact same benefits. So the benefit of SLMB and QI1 is that they pay for the Medicare Part B as in boy premium, that $134 a month, and you also get the full extra help benefit that we talked about with your premium reduced by $30.62 for the plans that participate, no deductible, no donut hole, low copay. However, SLMB does not pay for the 20% Medicare doesn't pay or the Part A and Part B deductibles. I have had some questions by volunteers or even clients saying, I don't have an SLMB or a QI1 card. You will not get a card from the Bureau of TennCare that says you have SLMB or QI1. So there's going to be no cards associated with these two plans. When it comes to QMB, the beneficiary may receive a pink QMB card, but I'm going to talk about that a little bit more when we talk about dual eligibles, because not all QMB beneficiaries are going to get a pink QMB card, and I'll explain why in a little bit. So I will answer that question that you have that just popped in your brain, because I know it did.
Okay, we actually do have a question.
Okay, before we get to questions, let me say one more quick little thing. There's one difference between the SLMB program and the QI1 program, and that is that SLMB is going to be around forever. It'll take an act of Congress to get SLMB to go away. However, QI1 is a grant-based program. So the federal government allots a certain amount of money. We don't know how much money. We don't know when we get the money. Allots a certain amount for QI1 benefits. So if you qualify for the QI1 income guidelines, which I'm going to put back up on the screen for you, you qualify for the benefit, but the state has no more money because it ran out because they have the maximum beneficiaries for QI1. Even if you fall within those guidelines, if state funding has run out, you will not qualify for QI1. So it is a grant-based program. When the money runs out, no one else can qualify. Go ahead with your questions, Lonnie.
Okay, so Nancy Parker has a question. So what is QI1 income limit for a family of 3? She said this is an actual call that she has to make.
Well, in that case, let me, because I do have that information. So I'm going to pull it up on the screen here in just one second. So this is some of the additional information that I sent you in the brochure or in the email. So to answer Nancy's question, I'm going to look at it. So QI1 for a family of 3 is $2,358. And again, I'm going to go over these benefits and these resources here once I'm done talking about all the income and stuff. But I think that should answer Nancy's question.
Okay, there is another question. Can a person who has had QMB, but now because they live in assisted living with VA helping pay for their care, can they apply for Medicare savings?
Yeah.
If so, do they count the VA income that helps pay for the assisted living?
So I believe what you're referring to is aid and assistance. And yes, aid and assistance does count as income. The reason I know that is because that question came up a couple weeks ago with another client, and we talked to our TennCare processing team, or my contact over there, and she said yes, aid and assistance income does count as income for the Medicare Savings Program and LIS income and resource guidelines.
Okay, so that's all the questions that have been typed in.
All righty, you want to open it up?
I will open it up. Okay, everybody.
Anybody else? Y'all are open.
I have a question.
Sure, who is this?
This is Stephanie Tab.
Hey, Stephanie.
Hey, how are you? Question, I just want to get clarity when we're talking about the resources for, are you able to hear me?
Yeah, we can hear you.
Okay.
Resources.
Okay, resources for QMB and QI1. When we're talking about resources, they include the $1,500 or $1,500 person. That's the extra resources. When we're talking about married couple, is that $750 a piece for each married couple, or is it $1,500 for each individual person that's married? Hope that question is clear.
No, I understand completely. It is $1,500 per person. So a single individual would get $1,500, a married couple would get $3,000.
$3,000. Got it. Yeah. I did my calculations wrong on this. Thank you. No, I didn't, because I did it because initially I thought that they only got $750. I only thought they got half of that. Okay. All right. Thank you.
You're welcome. Thank you for the question. That was a really good clarifying question. I like it. Lonnie Carroll. Oops. I think we have a question, but you're kind of far away. You can come closer to your mic.
Lonnie, can you hear me?
There you go. Yeah, now we can hear you.
Okay, it's Carol.
We can hear you.
It's Carol Samuels. On the aid and assistance, you're talking about the VA aid and assistance?
Yes.
And it counts as income?
Yes.
Okay. Because for some of the other things, it doesn't count. That's why I...
Right, exactly. Yeah, not all VA benefits count, but if you'd like, Carol, shoot me an email and I can forward you what my contact said if you need that for any kind of principle, if you want it for your records. And that goes for anybody. If you want me to send you what my contact at TennCare said about that aid and assistance, feel free to just shoot me an email and I'm happy to send it to whoever would like it. And I am fully prepared to have about 75 emails when I get off this.
Thank you.
No problem. Anybody else have any other questions?
Yes,
Go ahead.
If someone applies for QI1 and is rejected because funding ran out.
Hey, Lonnie, hang on 1 second. Lonnie, can you mute everybody? We're getting a lot of background noise and I can't hear your question. And then, sorry. Go ahead.
Okay. If someone applies for QI1 and is rejected because funding ran out, do they have to reapply the next year?
Yes. So if you're currently a QI1 recipient, and you will continue to have QI1 benefits as long as you still qualify. So you don't have to reapply every year if you're already qualified. However, if you want to qualify and the money runs out, you're a new enrollee, new application, trying to get on QI1 for the first time, and you're denied for funding being ran out, you do want to apply. I don't know if it's going to be next year. We haven't been told when we get funding. If we think about it logically, in my mind, and I probably shouldn't say this because we're recorded, but we are on, the federal government gives money on a federal fiscal calendar. So it's, and you know what assume means, but I can't cuss on recording. It may be a safe bet to assume that new money comes October 1st, since that's the federal fiscal year. I will do my best to try and ask again to our TennCare contacts, but I haven't been successful in getting a clear answer of when they get that QI1 funding.
Okay, that's all the top questions.
All righty. Well, I'm going to go ahead and we're going to talk, excuse me, about the QDWI program, which sounds like we're pulling over people who are driving drunk. QDWI stands for Qualified Disabled Working Individuals. So just by that title alone, we can already eliminate some people from being able to qualify for this program. So first of all, they have to be disabled. So that means the only people who are going to qualify for this program are people who are on Medicare due to disability and are under the age of 65, right? Qualified disabled, so they have to be under 65, be on Medicare due to Social Security disability income. Working is our next word we have to consider. So not only does this person have to be disabled and qualify for Medicare, but they have to be working. That doesn't mean they have to be working full-time. They could be working part-time or whatever, but they have to be disabled and working to qualify for this program. And they have to, their income guidelines can be $4,132 for an individual, $5,572 for a married couple. Holy cow, that is a super duper high income. I'm excited. Their resources can be $4,000 for an individual, $6,000 for a married couple. So that decreases their resources even though their income goes higher. But what is their benefits? QDWI only pays for the Medicare Part A as in Apple premium. Now, it doesn't pay for the Part B premium, it doesn't pay your coinsurance, doesn't pay your deductibles. So it doesn't do anything like that. It only pays, excuse me, for the Part A as in Apple premium. Now, think back to your training. There's only about 1 to 5%, really only about 1% of Medicare beneficiaries across the country that have to pay a Part A premium. And that's because they haven't worked the 40 quarters and paid into the Medicare tax or the FICA tax. Those beneficiaries would be responsible for a Part A premium. And I don't know what those numbers are off the top of my head. I can get them for you, but I haven't memorized those. It's going to be in the 400s or even in the 200s. It's going to be a high premium. But if you're disabled and working and you haven't gotten enough quarters to pay for a premium-free Part A, you may qualify for QDWI to pay for that Part A premium while you work. It's a very rare program. However, this year I feel like we've had more, well, this year and last year, I feel like we've had more people who wanted to apply for this program than in years past. So again, the big things to take away, the beneficiary has to be disabled. So if someone comes to you who's 70 and they want QDWI, they are not going to qualify. They are over 65. If you're 65 or older, you are considered to be aged on to Medicare. You have to be under 65 to qualify for this program. And you have to be working. So if they say, I want to qualify for this, I'm under 65, but I don't have a job, I'm not working, they're not going to qualify. So there are very specific requirements of this program. All right, questions on QDWI. We don't really focus on this one at training. So it's very rare that it comes up, so we don't focus on it too much. So that could be the first time many of you have heard about QDWI. Any questions come in, Lonnie? Oops. I keep doing that.
No questions.
All right. So let me pull up some resources. So in your email that you got, and I apologize, there were a couple of you that may have logged on who didn't get the email because you logged on while we kind of started the webinar, but I will send everyone a follow-up email. One of the attachments you got was our 2018 LIS and MSP brochure. Again, this is an excellent tip sheet, so you don't have to memorize these numbers. So this would kind of be the front of your tip sheet. So if you qualify for LIS, you get your copays reduced, your monthly premium reduced, no donut hole, QMB, SLMB, QI1, all the benefits there. And here are your income guidelines. What Justin was referring to earlier was these resources here, any of the resources really, are lower than the ones that I discussed in the presentation. Here in this box, an additional $1,500 per person for burial costs can be added if it's in a separate / standalone account. So we were asked by some volunteers and some staff to not include the $1,500 in the brochure because it goes out to the public, and a lot of people don't have that burial expense in a separate account. So this is truly what their resources would be. And then they have that additional information that if they wanted $1,500 more, they could put in a separate account $1,500 and say it's for burial expenses. So I think that's going to clarify for the group what Justin was referring to earlier. And then some information on how to apply, which I believe we actually unworded that. I just didn't update this particular brochure. But we always want to try and get beneficiaries to talk to SHIP about applying because it helps us with our grant funding. The LIS application, once you get the hang of it, probably online through Social Security's website, probably only takes you about 10, 15 minutes. The Medicare Savings Program application, however, is probably going to take a little bit longer because you have to write it out and you got to fax it in. Another resource that I gave you is kind of what we talked about earlier with Nancy's questions. And I have to give props to Sherry Craig and the staff at South Central because they created this eligibility guide many, many years ago. Actually, the coordinator before Sherry created it, and Sherry's been kind enough, and her staff has been kind enough to update it for us throughout the years. So this, and I'm not going to go through all of it because I know we're kind of crunched on time, but this resource gives you up to a family size of 4. Yes, family size can get bigger than 4. If you need family sizes bigger than 4, we can get you that information. Here's the information that I talked about for that $20 disregard. And here's our resource guidelines, plus you're allowed that additional $1,500. So it goes into the income guidelines for QMB, SLMB, QI1, not QDWI. Again, we don't really focus on that program as much because it's so rare. But it also points out the Part D extra help or LIS income and resource guidelines. And then it also gives you bullet point by bullet point or check mark by check mark the benefits of the QMB, SLMB, QI1, full extra help, and partial extra help benefit. This is an extremely valuable resource. So I really hope that all of you print it off, or if you can't print it off, shoot me an email. I'm happy to print it off and mail it to you. But it's a very, very great resource. I use it all the time. And again, big props to South Central for helping update that every year. The last thing I wanted to show you all was how we got these numbers. So you don't think I'm just kind of pulling numbers out of the air. This is through Families USA, who is a very credible source. I actually went to their conference in January. They're a great organization. So it does show here are your family sizes, 2, 3, 4, 5, all the way to 8. Through the 120%, 135%, there's your SLMB. Here's actually 100%. You know, it says poverty guideline. This column right here is the 100%. 120, 35, there's your 150%. So even within this range here, the 135 to 150%, you could, and I don't recommend you do this because this might confuse you or just put more work on you, but you could estimate the maximum amount for those partial assistance groups. But personally, I wouldn't worry about that. So this is on an annual scale. If you go down a little bit more, here's our monthly scale. So here, remember I told you we had that $20 disregard. So QMB, if you just look at the federal poverty guidelines, is $1,012. All of our resources are going to add that $20 disregard, and they're going to be $1,032. So on and so forth for everything. Again, down here, these guidelines do not include the $20 disregard. And then here are our resources. So any questions on the resources that I've provided for you guys? Might be too much, I don't know. Any questions?
There's one question that was typed in, but this has nothing to do with like the LIS or MSP. It says, is there a minimum amount of money you have to make or set aside for Medicare to qualify for the free premium, for the free Part A premium?
No, there's no set-aside money. It is all based off of the Medicare tax or the FICA tax that is coming out of your check as you are working. I mean, not all employers pay the FICA tax. So if your employer does not pay the FICA tax, you may want to talk to your tax professional to see what you need to do to get that premium-free Part A. But as of right now, if you don't qualify for your employer to pay the FICA tax or you don't pay it yourself, you will have a over $400 premium if you have no work history or no quarters toward that FICA tax. And that's something, whoever asked that question, feel free to shoot me an email or give me a call, and I'm happy to talk about that one-on-one. Right. Any other questions? I believe Lonnie's opened up the group. All right. So, Lonnie, if you want to mute everybody.
Print it out.
We're getting a lot of feedback. Thank you. All righty. We talked about our additional resources. Excellent. Now, for the complicated stuff. So hopefully you're not super confused, because if you are, I'm probably going to confuse you a little bit more. And we're going to talk about dual eligibles. Now, I do want to preface this by saying we are not going to be talking about how to qualify for Medicaid here in Tennessee. I'm not talking about that. I'm not an expert in it. We have excellent partners who know way more about the Medicaid and TennCare benefits than I do. We have the Tennessee Justice Center, and we have the navigators for the Affordable Care Act that can help people actually apply for Medicaid in Tennessee. The only thing that Tennessee SHIP staff and volunteers do is the Medicare Savings Program, so QMB, SLMB, and QI1 applications. Everything else, we are not responsible for applying for. That's kind of out of our scope of our grants. But I do want to talk a little bit about the categories, and we're going to talk about how some dual eligibles pay nothing, how some pay a Part B premium, and how some could pay everything. So this was one of the categories or one of the topics that were asked on our year-end evaluation last year to add to our presentation. So hopefully, if you are on and recommended that, hopefully I live up to the expectation. So first of all, let's define it. A dual eligible means you have both Medicare and Medicaid, and that is a CMS, Centers for Medicare and Medicaid Services definition. To have Medicare, you have to have either Part A and or Part B. That means you have Medicare. And in order to get Medicaid, you have to qualify for one of the categories of Medicaid in your state or QMB. That's what we talk about when you're going to be a dual eligible. You have to have Medicare and Medicaid. In Tennessee, we have some of the major categories. These are not all of the categories in Tennessee. These are just the main ones. I'm not going to read them all to you, but you can see them all there. To apply for Medicaid, any of these categories, with the exception of Medicare Savings Programs at the bottom, you have to go through the healthcare.gov marketplace. Again, not including the paper application that we do for the Medicare Savings Program, those other categories, and institutionalized individuals. That's the Choices program. So for Choices and the Medicare Savings Program, sorry, that thing pop up and distract me. Choices and the Medicare Savings Program, those are the only paper applications. Everybody else has to go through the healthcare.gov website through the Affordable Care Act marketplace. Again, we're not going to talk about who qualifies for these categories or what the income and resource guidelines are. Not going to talk about that. I just wanted you to know these are the people who potentially could qualify for Medicaid in Tennessee. So Medicare and SSI, Supplemental Security Income dual eligibles. These are a unique group, and that's why I specifically am going to talk about them and not the other categories. The big thing I want you to know is SSI, again, Supplemental Security Income, because I love my acronyms and I forget to spell things out. Supplemental Security Income, I apologize for that, is determined by Social Security Administration. If you qualify for SSI, you automatically get Medicaid in your state. That is a requirement of the law that SSI recipients receive Medicaid. That's across the country. Now, if you qualify for SSI, you will not qualify for any Medicare Savings Program. So you don't have to do the 9-page paper application to get QMB, SLMB, or QI1. They're going to deny you because SSI trumps or is better than the Medicare Savings Program. So you don't have to worry about those. You also, we talked a little bit earlier that some QMB recipients get a pink QMB card. If you receive SSI, you will not get a QMB card. You will use your managed care organization card, and in Tennessee, our Medicaid managed care organizations are Blue Care through Blue Cross Blue Shield, United Healthcare Community Group, I believe is what it's called, our community plan through United Healthcare, or AmeriGroup through, well, AmeriGroup. Also, you must stay in that managed care organization provider's network for your 20% coinsurance to be paid. So even if you have Medicaid, if you go outside of the Blue Care, United Healthcare, or AmeriGroup's network, you're going to pay the 20% Medicare doesn't pay. So we talk about Advantage plans all the time, how important it is to check those networks of providers. Same thing goes with any category of Medicaid. You have to stay within networks, with one exception, and we'll talk about that. So that's SSI. That's a unique group, like I said. That's why I kind of singled them out in particular, a very unique group. So dual eligibles, depending on what category and what network restrictions you have, some beneficiaries who have Medicare and Medicaid pay nothing. Some beneficiaries are responsible for that Medicare Part B premium, and others are responsible for the 20% Medicare doesn't pay. So just because you have Medicare and Medicaid, there are some rules you have to follow if you want to have the 20% for Medicare paid for. You don't just get it automatically necessarily. Oops, sorry. I'm getting a message from Lonnie. I think something happened with her computer. Lonnie, where are you? Going to make her up. Okay, sorry about that. All right. So I broke this down into specifically talking about original Medicare beneficiaries, and then we're going to talk about Medicare Advantage plan beneficiaries. So bear with me and try and stay with me. I know webinars can put you to sleep, so I hope if you have fallen asleep, you come on back to me. So right now we're just going to talk about the dual eligibles who have original Medicare, meaning they use that red, white, and blue Medicare card when they go to the doctor. Okay? The beneficiary will pay nothing. They have no out-of-pocket expense if they qualify for QMB, if they qualify for SSI Medicaid, what we just talked about, and they stay in that managed care providers network, or if they qualify for another category of Medicaid, any of the other ones listed, and they have a Medicare savings program to pay for their Part B premium. If one of those three things happen, the beneficiary is going to pay nothing, meaning Medicare is going to be primary, Medicaid is going to be secondary, the beneficiary has no out-of-pocket expense. Okay, I'm going to ask for questions here when we're done talking about original Medicare, so keep typing them in, and I promise we're going to get to them. Again, only talking about original Medicare. Some beneficiaries do have that Part B premium to pay, even though they qualify for Medicaid, because it depends on the category. So income and resource limits differ from every category. For example, choices, I believe, is almost $2,200 a month. You can qualify for the choices program. It's like $2,199, and it very well could have increased for 2018. So if you can have $2,200 and qualify for choices, but you can only have $1,386 to qualify for QI1, you're not going to have your Medicare premium paid for if you have over that QI1 limit. So those are some beneficiaries, and I know a couple of you who are on the call have come across those beneficiaries where I see in Tennessee Anytime, or they say on Medicare.gov Plan Finder, full dual, but they tell me that they still pay their Part B premium, have TennCare pay for it. Well, they qualify for a different category, but their income is too high to qualify for the Medicare Savings Program to pay that Part B premium. Dual eligibles who pay coinsurance. So Again, we're only talking about people on original Medicare. We haven't talked about Advantage plans yet, so stay on the original Medicare track with me. People who have the coinsurance to pay. If you qualify for a Medicaid category, whatever that might be, SSI, child, caretaker relative, breast or cervical cancer, whatever your category is, and you go outside of that managed care organization network, then you pay the 20%. Now, there is one exception to that rule, and that is if you qualify for a category of Medicaid and have QMB, QMB trumps the other categories. So the provider has to accept QMB if they accept original Medicare. Now, that's confusing. Let me say that again. If you have any of the categories of TennCare that were listed on that previous slide, I'll say, for example, breast and cervical cancer, just as an example, and I have QMB and original Medicare. I go to a doctor, they say, we don't accept TennCare. They have to because you have QMB. Also, if you qualify for SSI and you go outside of the managed care organization's network, you're responsible for the 20% coinsurance because you can't qualify for QMB. All right. I know there's probably going to be a lot of questions and a lot of clarification. So, Lonnie, I'm going to open it up for questions if you have any that have been chatted in. Again, only questions that pertain to original Medicare and Medicaid, please. We haven't talked about Advantage plans yet. Oh, Lonnie, do you have any questions, or are you opening it up to everybody? I think you muted yourself. Oops, gosh darn it, I keep doing that. Ah, sorry. Lonnie, are you with us? You're muted, Lonnie. All right. I guess Lonnie doesn't have any questions. Lonnie, can you unmute everybody for questions? I think we might have lost Lonnie. Yep, I think we lost her. Okay, so let me see.
So happy everybody is here. Apologize for the mix-up. Honestly, I did not look at my schedule for today. I knew we had a webinar. So anytime that we have a webinar, we'll schedule it in for 11:30 to give you guys an opportunity to do lunch with it, to go. I think they do delivery on Thursdays downstairs.
Stephanie
Yeah, so I was trying to be considerate of that in case any of us wanted to do that.
I'm sorry,
anybody
Lonnie, where are you at? Lonnie, can you hear me? Stephanie Towns, we can hear everything you just said. Lonnie, are you with us? I am here.
I am here. Can you hear me?
Yes, now we can hear you. Okay.
Okay.
Did you have any chat box questions? Sorry about that, everybody.
Yes. One of them is, how do you know if someone qualifies for SSI? Once someone turns 65 and starts receiving Social Security, does their SSI end?
Well, that's a good question for Social Security. So usually, and not always, but the beneficiary should know if they're receiving SSI. I believe the SSI limit is no more than $735 in 2018. That could have changed. I don't know. Don't quote me on that. But in order to make sure, the beneficiary needs to contact Social Security and verify they have SSI. In terms of when it ends, that's a Social Security determination as well. Some beneficiaries could have SSI and Social Security income. So people have had both in the past. So unfortunately, you'd have to contact Social Security to see if the person qualifies for SSI, to have that peace of mind that they know they have SSI. Any other questions, Lonnie? Lonnie, you muted yourself again.
No, I'm going to call back in so I can get my computer and my phone link back up.
So do you think?
Well,
I
mute
just take it out. Okay, I didn't take it out. I did.
Thank you. All right, I apologize, everybody. Technical difficulties, gotta love it. So while Lonnie is coming back in, I am going to go ahead and continue with the webinar, and we can get questions afterwards. So now we are going to talk about dual eligible to have Medicare Advantage plans. Yes, some dual eligible have Medicare Advantage plans, and that is completely fine. That's their choice. Remember, we are a non-biased counseling resource, so if they want an Advantage plan, we can enroll them into an Advantage plan. So it's not a bad thing all the time. So a dual eligible will pay nothing if they qualify for QMB and stay in the Medicare Advantage plans network. That's a big thing. When we talk about Advantage plans, we discussed this earlier. You have to stay within that plan's network in order to get your coverage. If you go outside of a Medicare Advantage plans network, you're going to pay either a higher coinsurance, so maybe 40 or 50%, or you could pay 100% of the cost of your service. So it's very important on Advantage plans and on Medicaid you stay within your network of providers. The person qualifies for SSI and stays in the managed care network and stays in the Medicare Advantage plans network. So they have to stay, and hopefully the providers accept a lot of insurance because they have to stay within the Medicare Advantage plan network and that SSI managed care organization network for them to have to pay nothing. They qualify for another category, any of the other ones that are listed. They have a Medicare savings program that pay that Part B premium, and they stay in the Medicare Advantage plans network. All of those things have to happen for the beneficiary to not pay anything. So we get a lot of the time, we have beneficiaries coming in, I'm on a Medicare Advantage plan and my doctor, and I'm full dual, I have Medicare and Medicaid, but I get a bill for my copay. Why are they charging me? Well, probably because you've gone out of one of the networks and you have to stay within the network in order to have everything paid for you. The dual eligibles that have to pay a Part B premium on a Medicare Advantage plan, just like with original Medicare. The income and resources are different for every category. So just like our choices example, if you have a higher income and your income is over the QI1 benefit of the $1,386, that's the maximum you can have to pay your Part B premium, you may be responsible for it if your income is over that. And lastly, the beneficiaries who pay a coinsurance on a Medicare Advantage plan who are dual eligible, you qualify for a category of Medicaid and you go outside the managed care organization and or the Medicare Advantage plan network, you are going to pay a coinsurance or copayment. This is not the case, however, if you qualify for a category of Medicaid and you have QMB and you stay in the Medicare Advantage plan network. Also, if you qualify for SSI Medicaid and go outside either the managed care organization or the Medicare Advantage plan network, then you are responsible for that coinsurance. And I don't know if Lonnie came back yet because she has everybody muted, and I don't know how to unmute everybody.
Did go, sorry, like you got all of this.
Lonnie, are you back?
Sorry. On behalf of the HMS and the staff.
Yes, I'm back.
Welcome to the volunteer program.
There you go.
I've unmuted everybody.
Yeah, Lonnie, mute everybody, please.
Yes, that's right.
You got to mute Joni at least. All right. So, well, we know that we have a lot of volunteers who are having other conversations while they're listening to the webinar. So I apologize for that, everybody. Lonnie, go ahead if you had any questions that were typed in.
Yes, there is one question. It says SSI is up to $750, but vary because some have SSA also.
Thank you. Yes, I think that was last year's income that I mentioned, the $335. It sounds like someone did some research for me, and that income has gone up to $750. Kelsey just asked a question about drug coverage, and I'm actually going to talk about that next, Kelsey. It's a good question. Does your MCO work as a supplement to your original Medicare? In most cases, yes. The managed care organization, whether that be Blue Care, United Healthcare, or AmeriGroup, that will pay the 20% that Medicare doesn't pay if you qualify for one of the Medicaid categories. So yes, that is true. Same thing with a Medicare Advantage plan. They may pay your copay on the Medicare Advantage plan depending on what managed care organization of those three that you are enrolled into. Good question. And I promise I will get to your drug plan question here in a little bit. Lonnie, did you have any other questions come in? Sorry, I just saw that one from Kelsey pop up.
No, there is not any more that have come in.
Okay. Normally I would have Lonnie open it up to everybody, but we've seen we have a lot of volunteers who are having side conversations, and I don't really want to open that up again. So unfortunately right now, if you have a question, you are going to have to use the chat box. That way we don't have all of that background noise. So I apologize for that inconvenience, but that's how we're going to have to do it for right now. And to address Kelsey's question about the drug plan, oops, let's get back. So dual eligibles and drug costs. Excellent transition, Kelsey. I appreciate that. So dual eligibles will get assistance to pay for their drug costs if they qualify for any category of Medicaid. Any of those that were listed on the previous slide, their drug benefit, their copays will be reduced to $3.70 for brand names and $1.25 for generics. They'll have no deductibles, no donut hole, and their premium is going to be reduced by that $30.62 if the plan participates in the Extra Help program and the assistance program. So it is going to have to be, the drug coverage is through Medicare. Medicaid does not cover the cost of your drugs unless you are not enrolled into a Medicare drug plan. Then I believe they will cover a certain number of medicines. I can't remember off the top of my head. I want to say it's 5, but I'll have to do some research on that. But they may not cover all of the medicine. So it's very, very important, extremely important, that if you qualify for Medicare and Medicaid, the drug coverage of the beneficiary is going to be under Medicare, whether that's a standalone drug plan on original Medicare or you have a Medicare Advantage plan with drug coverage. It's very important that that drug coverage is through Medicare, through one form or another. Kelsey, I hope that answered your question. Okay. So that's all I have information-wise. Lonnie, did any other questions come through?
Yes, we've got one popped in from Debbie Thayer. Does SSI recipient automatically receive a MCO, or do they have a choice to keep regular Medicare?
Well, SSI beneficiaries will get an MCO through Medicaid. That's going to be their Medicaid provider. I'm not sure how the Bureau of TennCare puts a person into their managed care organization, but all SSI recipients will have one card for one of those agencies, but I'm not sure how those are selected. But the beneficiary will also have another card. They're either going to have the red, white, and blue card that's going to be their primary insurance card if they're on original Medicare, and then their MCO card is going to be secondary, or they're going to have their Medicare Advantage plan card through whatever company they enroll into, and then their MCO card is going to be secondary to that. So they will have at least one Medicaid card and one Medicare card to get that full coverage. Any other questions come in, Lonnie?
No, there's not any more. Do you want me to open it up since?
I'm very hesitant to open it up because we've had quite a few people have side conversations. If you want to open it up, go ahead, and then if we hear those side conversations, we'll just mute everybody again automatically.
Okay.
Make sure you won't scare them away.
Yep, mute it.
Make it simple. Make it simple. That's what we were trying to do, but that's okay. We can't.
Sorry, guys. Unfortunately, we have too many people talking in the background and aren't able to open it up for questions. If you do have questions and you want to shoot me an email, I'm happy to do any kind of clarifying questions.
Or they can raise their hand and I can unmute them.
Oh, there you go. I'm not sure exactly how that, you should be able to go beside your name and there will be a hand. If you click the hand, that will show Lonnie that you have a question and we can unmute you specifically to see if we can get the questions answered that way. Boy, it's exciting that this is going to be recorded for all the public to hear. Yay, at least it'll be entertaining, right?
Yes.
All righty, Lonnie, I don't see any hands raised.
I don't see any hands raised either.
All right,
and
so
I don't see any more typed-in questions either.
All righty. So with that, then, I'm going to thank you all so much for being on the webinar today. I do want to remind everybody the presentation that I updated this morning and sent to you all has the link to the survey to tell me how good and or bad I did on this webinar. Constructive criticism is always good. Bad criticism is, I mean, it can happen. But if you would please do me a favor and fill out that evaluation, that way I can know how to do better webinars in the future for everybody. And with that, Lonnie, you can stop the recording.